Good afternoon, everybody, for taking time to join this session on how to fast safely during coming Ramadan. Okay, I'm a senior consultant in Tantoxin Endocrine Department, and I'll go through how to the risks involved during for Ramadan for the patients with diabetes. So before I start, for all Muslim viewers, Ramadan Mubarak to you, and I hope everybody, including me, will be able to utilize the month of the holy month with a lot of ibadahs, as well as able to fast safely during Ramadan. So these are the topics I'm going to cover today, mainly covering the risks for diabetes patients when they want to fast during Ramadan, and some of the patients may not be able to fast because of the high risk. And then I will cover some of the medications we commonly give for diabetic patients and other common conditions such as hypertension and heart disease. So this is the first patient who is 62-year-old Malay lady on type 2 diabetes on insulin, 3 injections a day along with metformin. And she had recent admission for a serious condition called diabetic ketoacidosis recently. And she also suffers from high risk of other high risk, including the risk of having low blood glucose, which is hypoglycemia. So she would like to fast for the coming month of Ramadan, and what, as a clinician, what I would advise. So we can chat about this later. What about this lady who is pregnant, 24 weeks, who is also got type 2 diabetes on insulin injection twice a day, and would also like to fast during the coming Ramadan. Glucose levels are a little bit on the variable readings with both high and low readings. So what happens during Ramadan? Normally, as in Singapore, the fasting starts around say 5:30 or 5:45 in the morning, and until around 7 o'clock in the evening. So during that time, you're not allowed to eat and drink. So the food intake as well as the water fluid intakes is not there during the daytime. Whereas when we break the fast, because we've been hungry for a long time, sometimes there is a temptation to eat more at the night time. And not only the food and drinking, because of the holy month, everybody wants to pray and do ibadats, and people tend to sleep less during this month. Adding to that, Singapore weather is not that bad, but still quite humid, and there is a risk of having dehydration during the month of Ramadan. And then the people will be taking some of the medications, not just for diabetes, as well as for other conditions such as heart disease, which may affect the Ramadan fasting. Lastly, the diabetes, some of our diabetes patients may be taking insulin, the insulin injections, and with some of the insulins may work for longer duration. So that may affect the blood glucose levels during the Ramadan time, Ramadan fasting. So this is a graphical representation of the blood glucose levels. So the one in the red is fasting, and in the blue is when people are not fasting. The upper panel is actually for patients, for normal people without diabetes. As you can see, there's not much difference in terms of the blood glucose levels, apart from slightly higher levels just when they break the fast. Whereas in the lower panel is the blood glucose reading in patients with diabetes. As you can see, there is a good change when compared to not fasting, and the tendency to go for low sugar towards the end of the day, as well as increasing the blood glucose level when they break fast at iftar time. So this is a patient with type 1 diabetes who actually on insulin, who needs insulin to control the blood glucose. And as you can see, the different colors are different day. So we can see there's a large variation in type in the blood glucose levels. This is not in Ramadan, this is just in a normal day. So it may get worse during Ramadan fasting if they want to fast. So what are the risks? As mentioned before, during the daytime, there is a risk of having low blood glucose, uh, particularly if there is no, if they're on some of the diabetes medications as well as insulin. And in the nighttime, if you're not careful with the diet, the blood glucose level can go higher. And if it goes very high, there is a risk of having a serious condition called diabetic ketoacidosis. Apart from that, there is an increased risk of thrombosis and, due to dehydration as well, which can be increased in people with diabetes. The lower panel, the graph showing the risk of hypoglycemia in patients with type 1 diabetes on the left side, and on the right side, the patients with type 2 diabetes. In both diabetes, there is an increased risk of hypoglycemia. So Diabetes, International Diabetes Federation, along with Diabetes Alliance Ramadan, has come with the risk calculation. So this, only the last year, they've come with a scoring system where they look at several factors, including the type of diabetes or the patient's factor or the previous experience for Ramadan, or whether they're pregnant, whether they have heart disease or kidney disease. And they've come up with a scoring system looking at the different factors as mentioned here. So then they come with a score. If the score is below 3, the risk of fasting during Ramadan is less, so they can go ahead after discussion with their doctor. Whereas if it is more than 6, the score, it is a higher risk, and they should not be fasting for the Ramadan. So these are some of the common things without looking at the score. So these are patients who are not advised to fast. For example, the case 1 I mentioned at the beginning, the patient with had a ketoacidosis recently, as well as having risk of hypoglycemia, which is a low sugar. So these patients are, we advise them strongly not to fast because they have a very high risk of developing low glucose during the Ramadan time. So other conditions, for example, if they already have higher risk of hypoglycemia, and people with type 1 diabetes, nowadays people people have done studies looking at people with type 1 diabetes. Some of them, they may be able to fast after careful discussion with their doctor and adjusting the medications. But if their control is very bad, and the HbA1c, the glucose control is very high, and they are strongly encouraged not to fast. As you can see from our Lord, Allah subhanahu wa ta'ala have actually exempted people who are unwell, and diabetes is considered, particularly the control is bad, they are clearly exempted from fasting. Whether they can do the blood glucose testing, and most of the ulamas have allowed people to do testing. It's allowed, it does not invalidate the fasting. So these are some of the tips for how to fast safely. Discuss with doctor in advance, and if you're at higher risk, consider doing the trial fasting session during Shaban, basically, and then our dietitian will cover through how to control the diet later. I will cover on some of the medications later. Can they do exercise? Generally, if they are on no medications or insulin, they may be able to do exercise anytime, but generally to avoid severe strenuous exercise during the fasting period for most of the patients, particularly if they're on medications and insulin. This is a commonest medication used, metformin, which is quite safe during Ramadan. The risk of low sugar is less, so patients can actually take the usual dose apart from skipping the afternoon dose because of Ramadan fasting. Sometimes they can take the extra medication in the evening. Lipizide, this is also very commonly used in people with diabetes in Singapore, but this medication is associated with high risk of low blood glucose. So we have to discuss with the doctor before. Most of the time, the dose for the sahur need to be reduced during Ramadan fasting. These are another common conditions. The common drug is used as glimepiride and glycoside MR, generally safer, but most of the time if they're on once a day dosage, taking in the morning, sometimes we have to change the dose to iftar, and if the control of the diabetes is good, they may need some slight reduction in the dosage. This medicine we don't use in Singapore hospital, but some of the GPs may still be using, and this medicine is associated with very high risk of hypoglycemia, then better to avoid. And if they still want to insist that the dosage for the sahur needs to be really reduced. And this patient, this is also under the sulfonylurea group. They're quite okay to use apart from meeting lunchtime dosage and then slight reduction in the dosage for sahur. These are some of the medications which are safe during Ramadan. Usually there's no need to change during the Ramadan. Quite safe, the risk of hypoglycemia is less. These are medications which help to lose weight, is more commonly being used for diabetes because it is associated with a very better risk reduction for heart disease and stroke. Usually they are safe. Studies have shown safety during Ramadan, but if somebody is having heart disease and are taking diuretics to increase water excretion, then better to discuss with the doctor before Ramadan fasting. What about insulin? I'm not covering the insulin, all the insulins. These are commonly used insulins, different ways we use. Generally, the reduction of dosage needs to be done for sahur, as there is a risk of hypoglycemia during the daytime, and try avoid. And sometimes if you tend to eat more carbohydrate during the iftar, then the dosage of insulin needs need to be slightly increased. If they are just on one insulin dose, which is 24-hour insulin, mild acting insulin, then sometimes your doctor may advise to change the injection to the evening time if you are doing it for the morning during Ramadan fasting. So this is the case. This is a lady with 40-year-old diabetic patients already on insulin as well as tablets. Around 6 o'clock, she is experiencing symptoms which are suggestive of low blood glucose with shaking, feeling anxiety and shaking. She checked the sugar and is about 3 millimoles. And what does she do? What is the correct thing to do? Can she continue for just 1 more hour, just sleep through? But we generally advise not to do that because the low blood glucose can actually can kill, and it's quite a dangerous condition. So better to break the fast. So these are some of the things better not to advise not to do during Ramadan. It's a sunnah to start fasting with food, which is called sahur. So in diabetic patients, because of the medications, it's even more advisable not to start the fasting without sahur. And if the blood glucose is slightly high, better not to increase the medications dosage, the sahur time, unless the sugar is really, really high. In that case, it's better not to fast and avoid strenuous exercise during the daytime. And during the evening time, better not to drink the sugary drinks. And we normally give insulin like 20-30 minutes before eating, but for Ramadan, sometimes it can be risky, particularly if you're not the one checking the blood glucose, not to inject the insulin, where like 20 minutes before breaking the fast. So these are the times where we have to break the fast. Anytime the blood glucose is low or very high, more than 16 millimoles per liter, if you're unwell or if you feel like you're having low blood glucose, or if you're very feeling like fever, then definitely we have to break the fast straight away. What about hypertension? People with hypertension can be able to fast if the condition is very stable with the medications, and if the blood pressure control is not good, it is associated with labile hypertension, or increased blood pressure values are also associated with lower blood pressure value, then it's better not to fast. Similarly, the same for the heart disease. If the condition is stable, and if the doctor is saying, that every 6 months, something like that, then without any chest pain, then it's quite safe for fasting most of the time. But if your condition is unstable, if you're having more frequent chest pain, or you had a recent heart attack or surgery, then better not to fast. What about the heart failure? Again, the stable, the doctor is happy with your condition, then you can discuss before Ramadan and then fast. But if your condition is not stable, you're still having a lot of shortness of breath or a large leg swelling, and then if you got recent admission for heart failure, then better not to fast. What about kidney disease? Again, if it is mild, very mild kidney problem, and the condition is unstable according to the nephrologist or the specialist for kidneys, then you can fast. But if if your doctors are advised not to, if you're having problems, with a loss of leg swelling or breathing trouble, then better not to fast. So those people with, as mentioned earlier, it is uncontrolled blood pressure, the blood pressure is more labile, both low and high blood pressure, or other illnesses like heart disease, or having a lot of leg swelling, taking a lot of medication to pass urine, then these people are definitely advised not to fast. So coming last slide. So after after Ramadan, end of fast, you don't forget to change your dosage of the medications to the normal dosage, and then watch your diet carefully during Hari Raya celebration. So this is my last slide, and the safety is the priority. Okay, if you're unwell due to any reason, better not to fast. And if the doctor tells you that you're at moderate or high risk, then better discuss with your own doctor who may adjust your medication if you're still keen. And I hope most of the diabetic patients can fast safely if the right precautions are taken and discussed with their own doctor before starting Ramadan. Okay, Jazakallah khaira for your patience. And now we got question and answer session at the end of the session. So please, as mentioned before, you can type in the chat box. We will discuss at the end. Now I introduce the next speaker, who is Sister Nurani, who is our diabetes nurse clinician at Antoxing Endocrine Department, who will also run through some of the more safety features, and we will cover more about blood glucose testing as well. Over to you, Sister Nurani.
Thank you, Dr. Shakur, for the introduction. My slides, I'll be talking more in detail about the low sugar and the high sugar, as he already mentioned. So having to see the doctor before you fast is an important preparation. So at least you know at which level your risk assessment is. Okay, this is the contents that I'm going to talk about pre-Ramadan risk assessment. Second is frequency, how frequent you'll be monitoring your blood sugar, when you should stop fasting, and knowing the signs of completion while you are fasting during Ramadan. So normally we eat 3 meals a day. Well, majority of us, but during fasting, we eat 2 meals a day. And majority of the daytime, we are not eating, at least 13 to 14 hours. So there is a change in our eating. So the problem is when we miss any food, meal time in the day, that's when we have to make adjustment to our medication. So can a person with people with diabetes fast safely? Let's find out. So the preparation starts actually weeks before the start of Ramadan, which is actually in 3 weeks' time. So it's important that you know what is your risk factor, whether you're able to fast, and we can actually have a rough idea from the last fasting. Last year, past years you fast, but remember, as time you get older, there'll be changes in your condition, your health, and your treatment. So it's imperative that you actually go for the pre-Ramadan assessment. And you definitely need a glucometer Otherwise, it's difficult to monitor your blood sugar, whether you are safe or not safe to fast. So the frequency will depend on your risk. If you're high risk, by right, you should not be fasting. But of course, being Muslim, we always wanted to fast, irregardless. So you make sure that your doctor will actually provide the regime, make any adjustment, and you must be prepared to test more often. So of course, during fasting, especially the first week, you may not know what happens. So you need to fast a bit more often, you need to test a bit more often, and you must know when to stop. So knowing recognizing the signs of complications is important that to have a safe fasting. All right, so we'll talk about the pre-Ramadan assessment. It's best that it is done early as 1 to 2 months before Ramadan. This is to give enough ample time for you to make changes to your control, and for the doctor to actually provide any adjustment to your treatment. Next, this also ensure that during Ramadan you are well prepared and you are able to go through the Ramadan safely when you are fasting. And of course, during this time, your doctor would do some adjustment, and you could have actually fast voluntary. Usually Muslim, some will fast every Monday and Thursday. That will be the best time for you to test using the adjusted treatment to see whether you need further adjustment. All right, how frequent can you test? Of course, this is individualized because I have patients who don't like to prick their fingers. But it's imperative that for those knowing they are under high risk and they insist on fasting, they must be prepared to be testing up to 7 times a day. Because they may run into easily into low sugar, high sugar. So they have to be prepared to test more often. For those under the risk assessment, if they are under moderate to low risk, you can test, also can test up to 4 times, but for the very low risk where you're not taking any insulin or any high, strong dose of medication, you can actually 2 times a day. That will be all right. So it's individual. And of course, try to the first 3 days of Ramadan, because there will be a change from our usual routine. It's good that if you can monitor more frequently during the first 3 days of Ramadan. And from there, you will set how often you can test the rest of the month. Let's look into the testing time. When exactly are we supposed to test? Okay, for those who are at high risk, they must be prepared to test 7 times a day, actually 6 times. The extra time is whenever you are having a problem, like having low sugar or high sugar. So the most important is to test before sahur, immediately before your sahur. That's important. And the next test, because after 4 hours, you're probably having your sugars are all being stored, so you might be at risk of hypo, low sugar. So at 9 o'clock you can check, and the next will be at 12 noon. In between, if you're still fine, you check at 4 p.m. and if you can go on to at 7, mostly immediately before breakfast, before breaking the fast at iftar, and the 2 hours after iftar. So these are the timing that you can actually test for those who are at high risk. And of course, those who are prepared to test at this time, even though they're not at high risk, that will be good. All right. And of course, any time that they test will be the time when they are not feeling well. Okay, the 4 times a day, basically the same at sahur, at 12 noon before iftar, and the 2 hours after iftar. And we know after iftar usually we have higher sugar. So you have to test it so that make sure that your food is not too much. And of course, at any time, you are still able to test to see whether you're having low sugar or high sugar. So for those not having a high risk, you can actually test minimal before sahur and before iftar. But of course, anytime you are not well, please do test. Okay, so when you should stop fasting? When you are having dehydration, right? Dehydration comes from the fasting itself, because you're for 13 hours to 14 hours, you're not drinking. It can be due to your medication. It can be due to having high sugar. And feeling unwell, of course, you may not be, your sugar can be also high, but it can also be low. And having low sugar is from probably not eating sahur, probably your medicine is not being adjusted adequately, or through too much of activity, exercise, you can experience low sugar. And high sugar is when you are not regular with your medication, you are not feeling well, you are sick, having infection, then you can experience high sugar. So that's the time you are supposed to stop. Low sugar, when it's shown to be below 4, then you really have to stop, regardless of the time in the day. So knowing about signs of complication. Okay, so in dehydration, you'll feel thirsty, very thirsty than usual. So please drink plenty of water as long as you are not under fluid restriction. And you'll feel tired and you'll feel dizzy. So and make sure that you avoid places that are hot, and that means you don't go outdoors, especially in the day, to avoid feeling dehydrated. If you are sick, you are not feeling well, yes, please, if you think you cannot carry on, you are sick, you can't go about daily activities, please see a doctor to get treatment. And of course, if the doctor says, okay, you are not supposed to fast, please rest at home, don't wander around outside, and take your medication as prescribed. So we talk about the low sugar. Some people, they have all the symptoms, the classical symptoms. Some may not. So know your own individual symptom. Cold sweat, palpitation, and of course, you don't do anything, you can go weak and you can get confused. So the first thing you need to do is to test your blood sugar. And if it's confirmed below 3, below 4, which is 3.9 and below, you'd have to do something. Right, take something that is fast absorbing sugars, like regular Coke, not Diet Coke. Regular Coke, half a can will do. You can take juice, half a glass. You can make your own sugar drink from your refined sugar, 3 to 4 teaspoons. Or you can, if you're outside, maybe you should still be carrying sweets, because it can happen anytime. 3 to 4 sweets. And try to check again. If you don't have a meter, then you go on to break your fast. If you're outside, if you're at home, check again your blood sugar to confirm that it's above 4, which you are the safe range, and proceed to break your fast and eat your food. All right, we talk about the high sugar. High sugar, for some of you might experience. So most of the time you feel thirsty, just like in dehydration, eyes blurred, tired, and you feel hungry. So what you need to do, test, and if it's above 15, you know that you have to stop fasting. Make sure you're well hydrated with plain water, and you can continue with your medication because you are not fasting anymore. And eat, of course, with diabetes medication, you have to eat after that, and make sure you see a doctor or consult your doctor or your diabetes nurse. So if you are experiencing complications while fasting, okay, update or call your doctor or diabetes nurse if you're given their contact. The doctor will actually analyze your blood glucose profile and will give advice on what to do and make further adjustment to your diabetes treatment if you are fit to continue fasting. So after Ramadan, that's not the end. After Ramadan, don't overeat. If you can manage to control your diet and you're well during fasting month, you can continue doing it for the rest of the year. And continue to test your blood sugar, because remember, you are actually readjusting your diabetes medicine to your usual regime. And of course, you continue seeing your doctor. Well, to continue, as I said, it's good that you can continue having this healthy lifestyle, because most of us will actually will not gain weight. But of course, after celebration for Hari Raya, we may lose that benefit. So continue for the rest of the year. So in the summary, fasting with people, for people with diabetes has many challenges. And every year is different. So the main risks are mostly, we find out, is low sugar, high sugar level, and dehydration. The three common risk complication. So early preparation before Ramadan is important, and all these are to reduce the risk of you getting complications during Ramadan. That is my last slide. And thank you for listening. And I would like to introduce you to our dietitian, Rachel. She will give you more in depth in the diet. Thank you.
Good afternoon, everyone. Thank you, Sister Noraini. So hi, I'm Rachel. I'm one of the dietitians here at Tan Tock Seng Hospital, and thank you very much for tuning in to our Fasting Safely during Ramadan series. So for this segment, we'll be sharing some dietary tips on how to help control your blood sugar levels during fasting. So we'll briefly talk about the healthy food plate, some sources of sugar, fats, and salt. What are some healthy feed practices that we can adopt, and some healthy eating practices during our sahur and iftar meals, and also during Tarawih. I'm sure that plenty of you have come across this diagram, which is my healthy plate designed by the Health Promotion Board, which gives us a visual guide on creating a balanced and healthy meal. It also shows us what to eat in the right proportions and also have a variety of foods. So for the top left-hand corner of the plate would actually be our rice and alternatives food group. And foods that actually fall under this category are our main source of energy. So we should choose foods that have more fiber in them. So complex carbohydrates such as chapati, oats, wholemeal bread, wholemeal biscuit, brown rice bihun, the reason being because they take longer time to digest, resulting in better control of our blood sugar levels. So half of my healthy food plate would actually contain our fruits and vegetables. So fruits and vegetables are rich in dietary fiber, vitamins, and minerals, and can lower the risk of developing heart diseases, stroke, and certain types of cancer. So we choose a variety of these fruits or any vegetables so that we can get a variety of nutrients that we need. So aim for 2 serves of fruits and 2 serves of vegetables a day. And I'm sure you're wondering what is 2 serves of vegetables or what is 1 serve of vegetable. So 1 serve of vegetable would be equivalent to 3/4 cup of cooked vegetables or a 1/4 plate of cooked vegetables. Or if it's easier to visualize, if we go to the nasi padang stall, if we order 2 portions of cooked vegetables, it's equivalent to 1 serve of vegetables. Okay, so having 2 serves of vegetables a day will actually help to meet our dietary requirements together with 2 serves of fruits. So moving on to the number of serves and what is 1 serve of fruit. 1 serve of fruit would be whole fruits such as apples, oranges, pears, 1 medium size. So you can use your fist as a guide. It's equivalent to 1 serve. A medium banana is 1 serve of fruit. Cut fruits such as papaya, watermelon, honeydew, pineapples. So if you go to the fruiterer, 1 slice or 1 wedge is equivalent to 1 serve of fruit. And the reason why we would recommend having the whole fruit instead of the fruit juice is because you need more fruits to actually make up to 1 cup of fruit juice. So for example, 1 cup of orange juice, you might need about 4 to 6 oranges. And having that would actually mean that you are just taking the sugars from the fruit instead without the fiber, because most of the fiber would have been extracted by the juicer. And the last quarter of our plate would actually consist of our meat and alternatives. And this food group is important because they help to maintain our muscle mass and help give us a healthy immune system. And sources of protein can be found in foods such as chicken, eggs, fish, lean beef, lean mutton, and tofu, and beans, and our dairy products. And if you are lactose intolerant, milk and milk products might contain lactose and might not be very suitable. You can opt for unsweetened soya milk or reduced sugar soya milk to help receive some of the calcium and protein, or even calcium fortified tofu, meaning that tofu have already been added calcium to help to achieve your protein and also your calcium intake. So for this segment, I'm sure many of you have also heard that to avoid this food group, reason being because foods and beverages with added sugars usually have very minimal nutritional value. And apart from that, they tend to cause our blood sugars to rise, resulting in high blood sugar levels. Hence, try to have less of these foods. So for example, soft drinks, malted beverages, 3-in-1 beverages, even adding some syrup to your water can also increase your blood sugar levels. Things like kuehs, cakes, pastries, chocolates, ice creams are also high in sugars. And foods like these usually do not give us a sustainable amount of energy. Hence, they might make us feel hungry more easily as well. So sources of fat. Fat is needed for certain functions in our body. However, it's also a concentrated source of energy. So having a diet high in fat can actually provide us with additional calories that we don't really require, resulting in the risk of us becoming overweight or obese. So how do we reduce the fat intake in our meals? Firstly, we can reduce the amount of oil or the amount of fat that we find in some food when we are cooking, or by having foods that have less gravy, or foods that have been cooked with a healthier cooking method can also reduce our intake of fat. So one thing to also avoid or reduce is our intake of high saturated fat. And what are saturated fats, right? So saturated fats are our food products that are usually made from animal fat. So animal fats and skin, for example, chicken skin or the whitish part of the beef, mutton, and also butter contain saturated fat. So these fats actually then increase our bad cholesterol, our LDL cholesterol, hence increasing our risk of getting heart diseases and stroke. Full-fat dairy products do also contain desaturated fats, and palm oil and coconut products. For example, food products that have been made with coconut milk, like kuehs or curries that have been added santan, usually have higher amounts of saturated fats as well. So to reduce the amount of saturated fat, we can opt for these other alternatives. So for example, for palm oil, you can choose other oils such as canola oil, peanut oil, olive oil instead, because these oils have lower amounts of saturated fat. And for your full fat dairy products like your full cream milk, full fat cheese, full fat yogurt can be replaced by the lower fat alternatives. And for butter, olive oil, margarine, or soft margarine like olive oil spread, canola oil spread have also lesser amount of saturated fat. So use these instead of butter when you are spreading your bread or when you are cooking. And for coconut cream, coconut milk, or cream that we usually add into our cooking, opt for lower fat alternatives like low fat milk or low fat evaporated milk. Or we can also add some soy milk into our cooking or low fat yogurt into our curries as well. So salt, though, is essential for our body to function, but having large amounts of them can actually lead to increased risk of high blood pressure and stroke. So where do we usually find sources of salt? Right, they're usually from processed or preserved foods such as salted eggs, salted fish, preserved meats like sausages, ham, and snacks. So snacks such as instant noodles, potato chips, they're usually flavored with salt, and the seasonings are usually contain quite high amounts of salt as well. And apart from that, having quite a large amount of these salty or high salt foods can actually make us feel thirsty also. So when we are fasting during Ramadan, because our risk of dehydration has really increased, right? Having these foods have even increased our thirst. So try to limit these snacks during the sahur meal as well. So when we are cooking, salt can also come in the form of not just salt on its own, but also sauces like soya sauce, fish sauce, and also oyster sauce, and chicken stock that we usually tend to add in our soups. Okay, so if you want to bring out the flavors of the foods, you can use natural flavor enhancers such as curry leaves, capsicum, carrots, chili padi, herbs and spices, which Teresa will be using some during her cooking demonstration to bring out the flavors of the food instead of increasing the salt in our diet. So some healthy cooking practices that we can adopt. Actually, the only cooking method that we usually try to avoid is deep frying. Okay, so there are a variety of healthy cooking practices. For example, boiling, roasting, steaming, pressure cooking, stir frying or air frying, grilling, and microwaving can be used as some of the ways where we can get a healthy meal. Okay, so the whole idea is to not just practice these healthy cooking practices, but also to add less oil when you're cooking, and also use less salt or sauces when you're cooking. So healthy eating practices during sahur, iftar, and our tarawih, it's that having a healthy diet during Ramadan is important to help us keep our blood sugar levels as close to normal as possible. So divide your meals or your calories into two main meals, which are the sahur meal and also the iftar meal. Okay. So for sahur meal, try to have your sahur as late as possible to minimize the period of fasting. Okay, having moderate amounts of carbohydrates can help to prevent an excessive rise in our blood sugar levels, and try to choose carbohydrates, so foods that contain more fiber. So for example, instead of having white bread, choose those with whole grains like wholemeal bread, or instead of prata, have chapati instead, brown rice or brown rice bihun, because fiber can help us feel fuller for longer and also prevents the sharp rise in our sugar levels. By including some protein, So for example, adding an egg into your bread, or having tahu or fish or some beef into with the rice can also help us feel fuller for longer. So my healthy plate can be applied to both the sahur and the iftar meals to help us maintain a good balance of carbohydrate, protein, and fiber. And during the sahur meal, try to have less of the deep fried foods like curry puffs or goreng pisang, because deep fried foods usually tend to make us feel quite tired and sluggish throughout the day. And as mentioned earlier, so sugary foods and drinks, like 3-in-1 beverages, can actually make us feel tired because they don't give us sustainable energy. So iftar should begin with 1 to 2 cups of water or unsweetened beverage to hydrate yourself after a long day of fasting and to help to prevent dehydration from the fasting. So followed by 1 piece of large date or 2 pieces of small date, or you can also have 1 slice of fresh fruit. For example, 1 wedge of watermelon to provide you with a quick boost of energy. So gentle reminder is to limit yourself to 1 serve of fruit, so either 1 large date or 2 small dates. So the reason being because after you have fasted, and we don't want you to have too much of the carbohydrates at one go, which will then increase your blood sugar levels. So similar to the sahur meal, use the healthy plate to guide your meal times and pace yourself. I know it's easier said than done, but fast eating usually tends to lead to overeating. And our satiety signal, so our signal that tells us that we are full, usually takes around 15 to 30 minutes to reach the brain from the time we start eating. Okay, so apart from that, some tips where we can prevent ourselves from overeating would be to eat mindfully. So when you have started eating, chew your foods for at least 15 times and try to enjoy every bite that you are having. Portion out your meals if you are trying to not overeat. So you can portion out your meals at the beginning of the meal time. Have your meal at the table instead of eating it in front of the TV or eating in front of the laptop, because this will then reduce our satiety signal also. If you are snacking, try not to snack out of the container or out of the bag, because this can lead to overeating as well. So instead, just portion some out so that you can visualize how much you are actually eating. And if you're trying to eat less, then you try to portion it into a smaller bowl or a smaller plate to reduce the portion that you're having. So non-starchy vegetables are also very important. So non-starchy vegetables would be vegetables such as our long beans, so kacang panjang, kubis like cabbage, sawi, carrot, because these can help us prevent the sugar spikes also when we pair them with a carbohydrate. So when we pair them with our rice, with our bihun, and bread as well. Okay, so this one we have mentioned it earlier, so prevent or avoid having these foods, because this will then tend to increase our weight and hence also increase our blood sugar levels. So after Tarawih, it can be strenuous, and if you feel hungry, try to choose a healthier snack. So a healthier snack would be, for example, 1 to 2 slices of wholemeal bread, but try to include a protein in it also and some vegetables. So you can either add maybe 1 slice of low-fat cheese or 1 hard-boiled egg and have some slices of cucumber, tomatoes to make it a wholesome snack. If you want, you can have a cup of low-fat milk or 1 cup of consistent soy milk. Or if you haven't eaten the other serve of fruit, you can have the other 1 serve of fruit or half a cup of steamed chickpeas or 1 cup of plain popcorn can also help you not have excessive rise in your sugar levels. So if you can't remember anything from this talk, we do have some information on our health library, and they are printable, downloadable, printable, where you can download it for yourself, for your friends and your family. and most of the information that we have discussed during this session can be found there as well. So in conclusion, healthy eating during Ramadan can help to prevent our diabetes from going out of control. So divide your main meal or divide your calories into two, which is the sahur and the iftar. And if you are hungry after, choose a healthier a snack. Okay, so ensure that your meals are well balanced. Use My Healthy Plate. That's the easiest way to guide your meal choices. And choose foods that are rich in fiber. For example, your brown rice, chapati, adding beans to your soup can also increase your fiber intake. And limit those drinks and snacks that are high in sugar and those high-fat foods or snacks that have coconut milk, and use less oil and salt when you're cooking. So stay hydrated between the sunset and the sunrise by drinking plenty of water. But if you are under a fluid restriction by a doctor, then please adhere to that fluid restriction. So that's the end for my talk. Thank you very much for tuning in.
Thank you, Rachel. Thank you so much. So up next is a segment I believe everyone is the most excited for. So let's welcome Teresa. She's a nutritionist from IMEC Group who will be showing us a cooking demonstration of ayam masak merah. Teresa, please.
Okay.
Hi, Teresa. You need to unmute, I think. Yeah.
Okay, hello, so sorry about the technical problems. Okay, so let me restart myself. Okay, a very good afternoon to all tuning in, be it from Zoom or Facebook Live. Welcome to today's cooking demonstration featuring one of the very common food in the Malay cuisine, ayam masak merah, made with a healthier twist. As we know, the month of Ramadan is fast approaching, so our Muslim counterparts will actually soon be required to abstain from food and drink from dusk till dawn for about 30 days. And what to make this process better is to actually whip up a healthy and delicious dish to break our fast. Okay, my name is Teresa, a health coach from IMED, and this cooking demonstration is brought to you by Health Promotion Board. We are in for a treat today, so let's start cooking. Okay, so before we start cooking, let me just bring your attention to the screen. If you can see, is the ingredient list of the ayam masak merah, which serves four servings of it. Okay, so don't worry about capturing the ingredient, because later on we'll be sharing and showing you upfront of what ingredients that we are gonna use. Okay, so then after that we will be going through the method and like how to cook the ayam masak merah, and this cooking time will take us about 35 minutes. Okay, so before we start, let's just start sharing with you my ingredients. Okay, so first up we have our main ingredient, which is our chicken. Okay, so take a look at our chicken. We have actually marinated it with our turmeric and salt beforehand, because the recipe requires us to actually marinate our chicken 20 minutes before we start cooking, so that the turmeric and the salt can actually go into the chicken and make it more flavorful. Okay, next up, we definitely have our oil, which is the one that we use to cook our chicken. Okay, let me just open it. So like just now what our dietitian Rachel has mentioned, a healthier choice of cooking oil would actually be our canola oil. Okay, so over here I have about 1.5 tablespoons of it, because we do have quite an amount of chicken to actually work with. Okay, then next up we do have our spices, which our dietitian Rachel has also mentioned that we can switch out our seasonings to actually our herbs and spices. So over here for this dish, we do have half of our cinnamon, 1 star anise, and about 1.5 clove. Okay, so this will actually bring up the dish and the smell of the dish to make it more flavorful. Then after that, we will be having our lemongrass, which makes up about 1 lemongrass. So I actually cut it into half so that, you know, it will be easier to cook later on. So before we actually cook it later, we actually bruised it already. So if you can take a look, it's actually bruised with the back of our knife. Okay. So other than that, we also have our brown sugar to bring a bit of sweetness to our dish. Okay, so today's dish brings us a little bit of spicy, a little bit of sour, and a bit of sweetness. So this brown sugar will actually add on this small little sweetness to our dish. Okay, then moving on to our spice paste, because as we all know, ayam masak merah, the main gist of it is actually our spice paste, right? So definitely going into our spice paste, we do have our red bawang, which is our red onion. Okay, so this is chopped up, it's about 1 medium size, or if let's say you don't want it to be too strong, you can actually use a 1 small red onion. Okay, other than that, we do also have our shallots. Okay, shallots is just tiny red onions as I can, you know, describe it to be. So they are kind of similar. It's just that I think shallots are more fragrant in terms of the when we are cooking it, the flavor and the smell that comes out of it will actually be more flavorful. Okay, then other than that, we do also have our garlic. Okay, over here is about 1.5 cloves of garlic. And then after that, we also have our ginger. So this is about 2 inch of ginger. We actually already sliced it up so that it's easier to blend later on. Okay, most of the ingredients you can actually find them from the supermarket, and definitely because of today's cooking demo, we actually chop them up so that it is faster and is can also cook our dish for everyone to see. Okay, other than that, definitely the spice, right? We want a bit of spice in this ayam masak merah. We do have this dried chili, which I have actually soaked in hot water and removed its seeds. So let's say if you're a chili lover and you love to eat spicy food, feel free to, you know, omit removing the seed, because, you know, who can't stop a spicy lover from eating a spicy food, right? So this is our dried chili. It's about 10 pieces of dried chili soaked in hot water. Okay, moving on, we have our tomatoes over here. Okay, so this tomato is the one that we are using to make our ayam masak merah paste. Okay, so this tomato have actually been blanched already. Later, I will just show you a quick tip on how to, you know, blanch your tomato and also cut it so that it's easier to remove the skin later on. Okay, and then definitely this is all our ingredient list. So without further ado, let's get cooking. So the first thing we want to do, right, is definitely to on our frying pan, right? Oh, give me a while. This is not working. Give me. Wait, yes, working now. Okay, maybe my glove is a bit of a hindrance. So let me just, you know, just put on the blue glove for you. Okay, we want to have a bit of hygiene, right? Because we are cooking for a family of 4, or even if, you know, it's just a family, we definitely want to keep our hygiene top notch. Okay, so after our pan is heated up just a little, let me just view it. It's a bit heated up already. We will actually put in our canola oil. Okay. So we actually don't want to put too much of the canola oil, because, you know, like just now what our dietitian Rachel has said, too much fat is actually not good, even if it's a healthier choice of you know, oil. And we definitely want to have enough just to actually pan fry our chicken. So as you know, our makcik or our friends who actually cook at home, usually if let's say you know the recipe to ayam masak merah, we actually want to deep fry our chicken, correct? So over here today, when we are doing this cooking demonstration, we don't want to deep fry our chicken, because, you know, that's not what we are looking for. We are looking for healthier choice, right? So definitely we want to be pan frying our chicken. So over here, I have my tongs with me, and once the pan is a little heated up and I can feel the heat, Then I will actually start putting in my chicken. Okay, here the sizzle. Can you guys see the sizzle? Yes. Okay, so over here today we have about 4 pieces of chicken that we are working with. So because just now I said that this is a 4-serving recipe, right? So everybody get a drumstick, and this lucky one will get our chicken thigh. So chicken thigh and drumstick, they are actually quite good with their lean meat. Just to take note, we need to remove the skin of the our drumstick as well as our thighs, because you know, like thighs, they do contain a bit of our saturated fat, so eating too much of it is actually not that ideal for us. Okay, so now we can hear the sizzle, and I can actually smell the turmeric already. Okay, and it's actually getting a little charred. So let me just turn it over and let everybody take a look. Okay. Okay, so usually when we want to pan fry our chicken, we take about 5 minutes to let it pan fry. So when you're cooking at home, usually when we are waiting for the chicken to be pan fried, then we definitely want to be blanching our tomato, right? So over here, let me just show you. This is my blanched tomato, but here I just have a sample for you to take a look. This is a fresh tomato. So usually before blanching, we definitely want to be cutting like a small little cross from the front or the back, okay, any side. And then when we are waiting for the chicken to be cooked, we actually put the tomato into our boiling water for about 3 minutes to blanch it, okay? So after blanching it, then it will turn out a bit mushy, but you know, still solid over here, okay? And let me just show you over here that I have a full tomato that is blanched. Okay, let me just take a look at my chicken before I get it burned. Yeah. Okay, looking good. You can see a bit of char on our chicken already. So if you can take a look at the tomato over here, once when we put the X incision, right, then it's easier to peel it off like that. Okay, so when we peel it off like that, then we definitely want to be working with a smaller piece so that it's easier to blend, because we need this to make our tomato paste, right? Okay, so let me just quickly cut it over here for you guys. Okay, so it's quartered already, and then we'll put it over here while we check on our chicken. Wow, I can smell the chicken, and it's like nicely charred. Okay, so we wait about another 1 to 2 minutes before we off the fire and let it cool down for a bit, or before we've actually blend our tomato paste. So another thing that I want you guys to know, right, is that, you know, usually when we are cooking, we want the convenience of it, we want the fast process, right? We usually go to our supermarket and actually buy our canned tomato pulp of canned tomatoes. So actually all these canned tomatoes, they do you know, contain a higher amount of salt, and this is not very ideal for us because we do want to take note of our salt intake every day. So by, you know, making your own tomato paste, this is actually a healthier option for you to try out at home to make sure that you are breaking fast and eating a healthier meal. Okay, so my chicken is actually almost done. Okay, let me just off the fire, and we'll put our chicken on a thin plate. Okay, and we let it cool down a bit. Okay, so with our chicken done and put it aside, we will actually move on to our blending of our tomato. Okay, so over here, I do have my blender, my handy dandy blender. Okay, let me just put it on and show it to you guys. Okay, let me move a bit of my blender over so everybody can take a look at what's inside. So over here, I actually will put in my tomatoes. Okay, then after that, we will close up the blender. And then after that, we will start blending. We blend about for 20 seconds to 30 seconds. And then we take a look at our tomato. Okay, so if you can take a look at our tomato, it is well blended into our juices and our pulp. So we definitely want to, separate them out so that we can cook our tomato pulp into a paste. So over here, I have a strainer with me and I'll pour this out. Okay, so everybody can take a look. Okay, so this is our blender with strainer and we are gonna strain the pulp out and separate the juices with its pulp. It will take some time for us to actually drain it out, but if we want to have a healthier meal and we want to have a nice home cooked meal, then definitely and by cooking for your family, this is definitely the effort worthwhile, right? So fast enough, we get our pulp ready already. And then we're gonna heat up our pulp and heat them up to a paste, okay? So the heating of the paste will take about 5 minutes. So quickly, I will turn on my pan again. Okay, and then I will switch my pan because we don't want to have any oil in it to cause any, because we don't want to have too much oil in our tomato paste, okay? So over here, turn on the induction cooker again and let it heat up a little bit. And once it's heated up, then we can actually put in our tomato paste to actually heat it up. Okay, so okay, my pan is a little heated up already. This induction cooker is really good. Like it can heat up just within like maybe 10 to 15 seconds. Okay, so I'll put our tomato paste in and I can actually hear the sizzling of the tomato paste already. So we set aside our tomato juice because we still need our tomato juice later on. We together when we make our whole dish when it comes together. Okay, we set it aside. And then we start to move our paste around so that we don't get it burned. So about 5 minutes, then we can actually take it out and we will start with our spice paste. Okay, so for our spice paste, we also do need to blend them together to make it pasty. Okay, so I'll be using the same blender because later on we will just be mixing all our tomato juicer, tomato paste together. So to add on to the spice paste, we actually just have a bit of the tomato essence inside it. Okay. Okay, so as you can see, my tomato paste has already kind of been reduced to a more pasty texture. Okay, once it has been reduced to a more pasty texture, we can actually off the fire and we can start on our spice paste already. Okay, so we let it cool for a bit and we will move on to our spice paste. So I'll bring back my blender for you guys. This time around, we're gonna add in all our spices. So first up, we have our red onions. Okay, in it goes. Next, we have our shallots. Okay, in it goes. Okay, Then next we have our ginger. Okay, put it in. Our garlic, put it in. For me personally, right, I really love my garlic. So if I have a choice and I'm making this dish again, I will actually spam my garlic to make it more fragrant. Okay, but you know, it's really up to you. All these spices actually just brings on more flavor to your dishes. So all this measurement is just a rough guide to help you to, you know, make your paste. But if you know you want more spice, then definitely we wouldn't want to miss out on our chili. Okay. Okay. So in our chili, and then this mix up of our spice paste, and we will blend it away. Also, we will blend it for about 15 minutes, okay? And then we will take a look at our spice paste. Okay, so you see, right, it's actually not very, pasty yet. We're gonna add in a little more water, okay, to make it a little more easier to blend. Okay. So usually if you are blending this at home and you are just eyeballing the water as well as the spices, just make sure that later when it comes out as a paste, it's a little more watery. Okay, so that's your guide on how to see if your spice paste is ready. Okay, so if you can take a look at my spice paste now, it's a little bit more watery, right? Right. Okay, so this means that our spice paste is ready. Okay, so put our spice paste aside. And then now we want to focus on making letting the whole ayam masak merah to come together. Okay, so let me just bring back my chicken pan, the one with the oil, because we don't want to, add on extra oil to our dish, because just now when we pan fry our chicken, we do have some of the oil left, right? So we're just gonna use this oil to continue our cooking. Okay, so let me on the fire again. Because our pan is already heated up just now, so this time around, probably just 5 seconds, it will be heated up already. And then we can actually start to put in our spice paste. So just to show you guys again, this is how my spice paste look like. So please aim to, roughly have this kind of texture when you are, trying this recipe out at home. Okay, so I can actually smell the chili and the ginger all coming together. So I can already imagine when I put it inside the pan, the fragrance is just gonna come up even more. Okay, so put in all your paste. And let it sizzle for a bit. You don't want to, miss out on all the goodness of the spice paste. So I just want to make sure I get all the essence out from this blender. Okay, nice. So once we get all the paste out, then my blender has done its job for today, and I'll put it aside so that it's easier for everybody to take a look at everything else. Okay, so over here, my paste is actually cooking, so I can already smell the chili, the bawang coming together, and it's making my eyes a bit teary because bawang, right? Usually it does make you have a good, cheery moment. But it's okay because what will greet us at the end of the day is a very delicious meal of ayam masak merah. Okay, so remember just now when Rachel mentioned about the healthy plate. So today I will also be showing you an example of how my healthy plate look like, using our ayam masak merah as our protein, which is our chicken, and then I'll pair it with some rice as well as vegetables, and also have a side of fruit, so that this is how potentially one of your meal can look like after you break fast. Okay, so after cooking the paste for a bit, we do want to add in our spices. So your cinnamon, your star anise, as well as your clove, we add it in to have it a little more fragrant. Okay. Yes. So once I put in the cinnamon, I can actually smell the cinnamon flavor already. Just angle a bit. Yeah, so let's say if you really like a little more, spices, like you want it to be a little more, what's that, oriental, or let's say you want more cinnamon, you want more clove in, you can also feel free to add in a little more because, it's our personal preference. If let's say you like a little more oriental tasting, you can add a little more of these spices to help you to make your dish more flavorful and more suited to your palate. Okay, so after we put in the spices and we fry up our paste, then definitely it's time to actually put in our tomato paste. So if you can see, right, our tomato pulp, right, is not a lot. Even though it comes out from 2 tomato, right? But it's actually not a lot. So if let's say you are multiplying your recipe, then definitely do consider adding a little bit more tomato if you want it to be more sour. Okay. So after putting in the tomato paste, we remember our tomato juices. We also want to put them in. Okay, to add a little more, liquid to our paste so that it doesn't burn that easily, right? Okay, so when all the spices and the herbs come together, I can really, feel and smell the whole dish coming together already. So we are towards the end of the whole cooking, experience. So I do want to, show you like when we put in the chicken and then we simmer it and let you see how the whole dish comes together. Okay, so after we put in the tomato paste, then you see that it's actually a little more like the ayam masak merah paste. Okay, so we pan fry it for about another minute. Then we will add in our cooked chicken as well as our lemongrass. Okay. Okay, so it's looking good. Let me just add in my chicken. Okay, so in goes the chicken. So look at these yellow juices, right? It's actually not too much of the, oily parts. It's actually more of the turmeric color that makes it look like this. So we're just gonna bury our chicken in the sauce, okay? And then we're gonna add in our bruised lemongrass to let it have more flavors, okay? So before we close it for simmering, I do have a special ingredient that I would like to share with you guys. So usually when we cook ayam masak merah, right? We will put a little bit of the coconut milk inside, but this time around we don't want to add in the coconut milk because, just now as shared, our coconut milk do also contain a little of the saturated fat that we don't want to be ingesting too much of it. So over here I do have my chopped up almonds. Okay, so almonds are actually a good or a better alternative as compared to our coconut, and we do want to have this nutty flavor even though we are not using our coconut oil, right? So the secret is to actually add a little bit of water inside our chopped up onion, and then we're gonna mix it out. Okay, so when we mix our chopped up onions together with our water, right? I mean, it does look a bit unappealing right now, but it actually helps to dissolve some of the chopped up onion flavors, and then sorry, not chopped up onion, chopped up almond flavor. And then once we actually put it with our chicken to simmer, it actually brings out the nutty flavor. Okay, so once we have put it in, Okay, we will put all of our onions in. Okay, so once we have put it in, we mix it a bit before we actually simmer. Okay, my fire is a bit too big, so let me just off it first before I simmer it. So you know when we are simmering it, we don't want it to be a little too high heat because we actually burn our food. So I'm done mixing it up. So over here I do have my handy dandy cover. Okay, then I will actually simmer it for about 5 minutes. Yeah, so meanwhile, while we are waiting for it to simmer, I would like to see if there's any questions on the floor that I can actually answer. Okay, I think Madam Rosnani said, what's cooking? So today our main dish is our ayam masak merah, okay? Then wow, thank you, Jamie. You said the food looks good. Can't wait to see the final product. Okay, if you have any questions regarding the ayam masak merah, please feel free to type in the chat box, okay? And I'll see if I can answer them. Okay, so definitely when we are simmering it for 5 minutes, we do want to take a close look at our chicken to make sure that it doesn't burn too much. So over here, our chicken still look okay. Our sauces. So if you can, mix the sauces up a little bit. Right? Okay. So we close it back up and let it simmer for another 2 to 3 minutes. Okay, so remember just now I said, right, that I will actually be sharing with you the healthy plate example. So let me just show you with the angle. Let me move my stuff so that you can take a better look at the. Okay, guys, I'm so sorry that I forgot to add something to bring the sweetness to our dish. It's actually our brown sugar, but no worries, we can always add our brown sugar while simmering it because we just want to bring a little sweetness to our dish. Okay, so let me just add it in and mix it up. I can smell the whole ayam masak merah coming together already, which makes me a little hungry because I haven't had lunch. So I'm gonna have this for my lunch later on. Okay. So let me close it back up and let it simmer for another 2 minutes. Okay. So if you guys can take a look at my healthy plate. Over here, I do have my plate ready for you guys to see. So let me bring it closer to you to see. This is actually my quarter half the whole showing of the plate. So if you can see, half of our plate is actually our vegetables. Okay, then the other quarter is our whole grains, which is our brown rice today that we are using. But feel free to, if you like to use basmati rice or if you want to use quinoa, all this, you can feel free to use all these grains. Okay, so this empty slot, definitely I want to be putting my chicken, right? So later when I put on the chicken, then you will see the whole plate coming together. Then, of course, we do want to have a side of our 1 serving of fruits at the side to complete our meal. Okay, so I noticed that we have a question on the floor. Okay, Perry says, hello, Teresa, would like to check with you what does bruised lemongrass means. Okay, so bruised lemongrass, right, is actually the lemongrass using the back of the knife. Let me just show it to you. So you use the back of your knife and then you start pounding on the lemongrass. Okay. So what does this bruising of the lemongrass brings about is actually to help us to bring out the fragrance of the lemongrass even more. Because when you're just putting the whole lemongrass, right, we wouldn't be able to let the fragrance inside the lemongrass comes out. So by bruising the lemongrass, right, we actually let the inner flavor comes out, and when we cook it and we simmer it, then it is more flavorful. Okay, so my chicken is actually done, so let us take a look. Okay, let me get my tongs and show it to you guys. So you can take a look. My chicken is done. Okay, so for showing, I will just put one chicken drumstick on the dish to show you one portion of it. Okay. So if you like a little more, sauce, you can always feel free to add a little sauce to your chicken. But remember not to put too much of the sauce, because sometimes even though we are using a lot more herbs and spices this time around, but by eating all these sauces, it will actually give some it will actually have some hidden sodium in it. So especially if, let's say, you are too lazy to cook at home, and you want to go out and buy ayam masak merah, usually their sauces, like just now I mentioned, they use canned tomato juices or canned tomatoes, so they will actually bring about a hidden sodium that you are not aware of. Okay, so over here, I will just show you my completed dish. As you can see, is our chicken drumstick with our quarter of your brown rice and half of the plate of your vegetables. So over here, we do have broccoli and cabbage over here. So this is roughly what you can actually aim to eat as your breakfast meal. Okay, so this is my whole dish today. If you can take a look, let me just show you in a tray. Okay, so your whole plate of meal, as well as your one serving of fruit. Okay, so this marks the end of my cooking demonstration. So thank you guys for joining me on this cooking demonstration journey, and I will pass on the mic back to the moderator. Thank you.
Thank you, Teresa. Thank you so much. Yes, I hope everyone have learned how to prepare a very delicious yet healthy plate of ayam masak merah for your friends and family. Recipe has already been shared with you in both your confirmation email as well as the chat box. So do take a look if you want to revisit the recipe once again. Okay, lastly, let's welcome Faiza. She's a senior podiatrist, here to share with us more on how we can take better care of our feet, keeping them healthy and happy. Okay, let me share the screen. Okay, Faiza, please.
Hello, thank you everyone, and thank you Teresa for sharing that delicious recipe. So before we run off to cook our ayam masak merah, so allow me to share this last segment with you. My name is Faiza, and I'm one of the podiatrists here in Tan Tock Seng Hospital. So as a podiatrist, I attend to foot wounds on a day-to-day basis, and majority of my patients are actually people with diabetes. So today, I would like to share with you more on how diabetes can affect your foot and how you can take good care of them to prevent serious foot complications such as foot ulcer and amputations. My sharings today will not only be relevant to the month of Ramadan, but can also be applied any day, every day. But I will be sharing some foot care tips pertinent to the activities that we often do in the month of Ramadan, but you can also apply these tips any day, every day. Okay, I'll be conducting my sharing in English, but I do have the Malay translation on my slides for those who prefer to read in Malay. I also would like to highlight that there will be some graphic images of foot wounds in my presentation today that can make some people uncomfortable. So if you get a bit uncomfortable, you can perhaps close your eyes, but I hope you keep your ears open. Okay. So let's begin with diabetes complications, or how diabetes can affect your feet. So one of the areas of the feet or leg that diabetes can have an effect on is the blood vessels. So blood vessels is like the plumbing system in our body that transport blood. There are two main types of blood vessels. You probably heard of the term veins and arteries. So veins are blood vessels that bring blood from all parts of the body back to the heart, while arteries are blood vessels that bring blood from the heart to all parts of the body. So the blood in the arteries are blood that contains oxygen. So in a sense that you can say that arteries transport oxygen to all parts of the body. So the blood vessel I'm referring to here is the artery, the one that transport oxygen. So with diabetes, the arteries can get narrowed by the deposition of plaques, and which is pretty much made up of fats, calcium, and anything found in the body, in the blood. So you can imagine that once the blood vessel is narrowed, less blood can flow through, causing anything downstream to that blockage to receive less oxygen. So the implication of this is if you have a wound on your feet and there is a blockage in the arteries in the leg, the wound will receive less oxygen and unable to heal well. And if the blood vessel is totally blocked, you can imagine that no blood can pass through and anything downstream will be deprived of blood and oxygen, which can lead to gangrene, which is a part of the body that is already dead. So another part of the body that is commonly affected by diabetes is the nerve. So nerves allows us to feel our surroundings, whether we are stepping on something or if something feels hot or cold. These are our nerves at work. So with diabetes, it can cause damage to the nerves, resulting in over sensations such as feeling of tingling and crawling sensation, or reduced sensation such as numbness. This can be dangerous as you may not be able to feel your surroundings well when you're experiencing these sensations. So you might injure your feet without knowing. And if you don't know, you won't seek treatment for it and it can worsen. So the ligament is another part of the body that can get affected with diabetes. So ligaments are structures in our body that hold adjacent bones together. It is not very elastic, but elastic enough to allow movement in the joints. So it can get stiffer with diabetes, and when it gets stiffer, it does not allow joints to move. So the foot can get stiffer and can change shape. So you can see here in this photo that the toe is quite bent. So we call this the claw toe because it looks like a claw. So on this toe, you can see that the tip of the toe is bent and will not be in contact with the ground when walking. So this part of the toe is actually not designed to bear weight because there's not much fat or meat there compared to the other parts, just the part of the toe that's behind it that is quite fleshy or to cushion the impact on the hard ground. So what will happen to this part of the toe when it is subjected to pressure when you're walking on hard ground? So the body will start to lay more skin in that area to toughen and prevent the skin from breaking down. So this leads to the formation of corns and calluses on areas of high pressure on the feet. Also can happen on the feet due to injuries to the feet or as a result of corns or calluses that is too thick. And also here is referring to a wound. So you might ask, how can a thick corn or calluses cause a wound or an ulcer, right? So a corn or calluses that is too thick is also very hard. So you can imagine it like walking on a stone on your foot. For most of us, that can be painful, and we will try to change the way we walk to avoid stepping on it, or we will seek treatment for it. So if you recall in my previous few slides on nerves, people with diabetes can have damaged nerves that they can cause reduced sensation on the feet. So they can have this thick corn on their feet and they can continue to walk on it without feeling pain. So what tends to happen then is the underlying skin breaks down to form a wound like this. So you can see the picture on the left showing you a very thick callus, and then the one on the right, after the callus is being removed, you can see that there's actually an underlying wound there. That's what we call a diabetic foot ulcer. So I'm sure you have probably heard that diabetes can cause a person to lose a leg. And in fact, worldwide, one limb is lost every 30 seconds as a result of diabetes. So, but how does diabetes cause this? So it relates back to the things that I've discussed up to this point. So firstly, due to gangrene, which, if we can recall, is the result of poor blood circulation to the feet due to blockages in the arteries. The part of the foot that did not get enough blood and oxygen starts to die. So you can see in the picture here, the black toe is the gangrene. So when there is gangrene, because the part of the body is already dead, doctors will usually recommend for amputation to remove the gangrene to prevent infection from setting in, or if the blood circulation can be reinstated, they will allow the gangrene to remain dry and it will fall off on its own, or what is called auto-amputation. Another reason why a person can lose a limb because of diabetes is due to severe infection. So you can see in this picture here of a wound, so the red part, the red portion on the picture on the left side, that's the wound on the toe. But if you look closely, you can actually see this small hole right in the middle of that wound. So that small hole can sometimes get quite deep to bone. When that happens, along with swelling, redness in the picture next to it, and on the x-ray also, so you can see the x-ray with the circle yellow, right? The bone looks like it has been eroded away. Compared to the toe next to it, you can see a solid bone there. So all this is an indication of bone infection, and the most effective way to treat this is actually to remove the part of the toe that's already infected. So in some cases where the infection can be very severe and spreading up the legs, the doctor may need to amputate the leg to remove the source of infection and prevent it from spreading to the rest parts of the body, because that is deadly. Okay, so having seen all this scary stuff, how can we take care of our feet? So this is probably the most important thing that you can do actually for your feet, is to check your feet every day. So check all parts of the feet, including between the toes, heel, and the soles of your feet. If you do this daily, you will be aware if there's any injuries that you sustain on your feet without knowing. Once you know, you can treat it or seek treatment for it early before it gets bad. If you have difficulty bending down to your feet, you can ask a member of your family at home to help you, or you can even use a mirror, place it on the floor, and you can look through the bottom of your feet through it. So what do you need to check for? Check if there's any wounds, cuts, skin tears, blisters, or calluses with discoloration like the one in the photo. So the discoloration usually can look reddish, like the one in the photo, or like a black spot. So this might indicate bleeding underneath the skin and a potential ulcer underlying, like the picture that I showed you previously. So it needs to be treated before the underlying wound gets any deeper or infected. Okay, so should you notice a wound on your feet, what you can do first is also to provide, good wound care to it first. Clean it with clean water, or if you have any antiseptic solution or saline at home, you can use it too. After cleansing, you can use a piece of gauze or a clean tissue paper to pat dry the solution that you cleanse with. Apply antiseptic and cover it with a gauze or plaster. I know a lot of people will argue against this idea because we believe that, airing the wound will make it drier and heal faster. But airing the wound also exposes the wound to dirt and germs in the surrounding that can cause infection. So the trick is, once you apply the dressing or plaster, is to keep it dry and not to get it wet. So if you go to the toilet or for showers, you need to apply a plastic bag or something to keep it dry. If it gets wet, you need to change it immediately so that it will not retain moisture on the wound. Also, if you are using antiseptic cream, do not apply too much, just a thin layer, or you can also consider using the iodine solution instead and dab over the wound before applying the plaster. So this will reduce moisture on the wound and prevent it from getting too wet. So once you apply the wound dressing, you can change it daily and look out for these signs. Are there any redness, swelling, or warmth around the wound? Is there pus discharge? Or is the wound turning color like the one in this picture? And are you having a fever? So if any of these signs are present, it can indicate that your wound is infected or it is worsening. So go to see a doctor immediately to get your wound checked. Good skincare on the feet is also important to maintain good skin integrity. So cleanse your feet with soap and water daily and pat dry, especially between the toes. So if the toe can get, some of the toes can get very close together, and they actually may retain water and cause the skin to get too wet. So dry between the toes daily to prevent this from happening. If you notice that your skin is too dry, apply moisturizing cream and massage the cream in well so that it will be absorbed into the skin. So for this, usually we advise to avoid applying moisturizing cream between the toes. Again, for the same reason, we do not want in between the toes to get too wet. If you notice that you have a corn or calluses on your feet, do not use a sharp object like a penknife or scissors to trim it, because you can cut too deep and injure your foot. A safer method to get rid of it is to use a foot file or a pumice stone and to file down the hard skin. Yes, filing method takes a bit off at a time. It doesn't take too much of the calluses away, so you may have to do this quite regularly. But also try not to be too harsh. Don't file too hard, because you can also cause wounds if you do file it too hard. So the proper technique to trim toenails is actually to cut straight across and not too short. So trimming toenails too deep in the corners can actually cause ingrown toenails. If you trim your toenails straight across, you can actually see the edges growing out. But if you trim too deep into the corners, you might actually leave like a sharp nail spike that you can't see, and that spike will grow and pierce into the skin, causing ingrown toenail. So if you have a habit of cutting your toenails too short, you risk actually cutting the skin and cause bleeding and wounds. So try to avoid cutting your toenails too short also. Okay, footwear. For outdoor, we usually recommend covered shoes because it protects your feet more than a slipper or a sandal would. Avoid wearing slippers with straps between the toes, like the one in the picture, because it can rub and cause wounds between the toes. Inside the house, we usually recommend wearing like a bedroom slippers for protection, just in case you might step onto something that you did not notice or stub your toe against something. Try to avoid going about in barefoot for these reasons. So I mentioned wearing covered shoes is better than wearing open toe shoes for outdoor, but choosing the right fit is also important, because if you wear a shoe that is too tight or too loose, it can cause harm to your feet. So how do we choose the right fitting shoes? So for length, ensure that there is at least a thumb width space from your longest toe to the front of the shoe. And when you're checking for this, make sure that your heel is all the way to the back of the shoe to ensure that we are not missing out on any space that is unaccounted for. So second, the width of the shoe must be as wide as your feet. If you are able to see the shape of your foot outside the shoe is too tight. You can also check by placing the sole of the shoe over the sole of your feet to check for this. So if you notice that your feet is actually wider than the shoe, then the shoe will be too tight for you. And also consider wearing shoes with laces or straps, as it will anchor to your feet rather than your feet actually having to grip onto the shoe for it to stay on. This will also minimize movement and rubbing of your feet within the shoe, preventing the formation of blisters and abrasions. The laces or straps will also allow you to adjust to accommodate for any change in volume of your feet. So for example, if your feet tends to get more swollen at the end of the day, you can adjust so that the shoe will not be too tight for you. Lastly, always check inside of the shoe before wearing them, because sometimes there can be small pebbles or stones that we are not aware of that can actually injure your feet. Also check that the material in the shoe is smooth, that there is no rough seams that can rub and cause abrasions on your feet. So on top of the foot care advice that I have shared, some further tips that you can take note of for activities in the month of Ramadan are as follows. So for example, when you are performing your prayers for Tarawih or when reading the Quran, for example, you can consider using a thick cushion mat, such as an exercise mat or a yoga mat, and you can lay your sajadah over it to reduce pressure on bony areas of the feet, such as the ankles. These areas are at risk of injury if you sit in a position that place them in contact with the hard ground for a prolonged period of time. So you can also consider wearing a thick padded socks or adding added cushioning for the same reason. And if you are going to sit on the floor for a prolonged period of time, you can also consider to sit with your legs extended, again, so that you won't put pressure on the bony areas like the ones on your ankle. Or alternatively, you can consider performing your prayer while sitting on a chair or rather than on the floor, especially if you have a foot deformities and are at risk of high pressures on the areas of your foot. So we have also discussed previously the importance of keeping the toes dry to prevent excess moisture on the skin. So do dry the toes after your solat or wudu, because excess moisture can cause skin to get wet or macerated and increase risk of skin to break and also fungal infection. Again, we also have discussed this, avoid walking barefoot at all times. So if you're going to do cleaning of your house in preparation for Eid or preparing for iftar, wear slippers to protect your feet while you're at home. So when you're going for your Eid shopping or grocery shopping, wear well-fitted socks and shoes to protect your feet. So with that, I end my presentation. To fellow Muslims in the audience, have a safe and blessed Ramadan and Eid Mubarak to follow. Thank you.
Thank you, Faiza. So we have come to the end of our sharing segment. So we'd like to thank everyone for tuning in, but don't go anywhere. Our panelists will now answer your questions. So if you happen to have any questions, do type them in the chat box. We will direct the questions to our speaker shortly. Okay, so I have some questions on hand already. So I'll just direct to the speaker. So firstly, to Dr. Abdul, one of the question actually asked, is it okay to exercise after iftar? Is doing Tarawih 20 rakat similar to exercising? Yeah.
Okay. So I think I showed a slide about exercising, better to avoid during the Ramadan fasting. But after Tarawih, after taking iftar, is a good time to do exercise. But bear in mind that you need to, it depends on what medications you're on. For example, if you're on insulin or some of the medications which can reduce the blood sugar, and if you're going to do some very intense exercise, you may have to reduce the dosage of insulin. So better you discuss with your own doctor who knows better about your diabetes condition. But generally, yes, you can do exercise after iftar during Ramadan time. Particularly if you're not on taking on insulin, just on medication or diet control, you can do it safely. Of course, the Tarawih is a form of, considered as a mild form of exercise, particularly if you do like 20 rakats, then which can go on for about an hour or so. So it can be considered as a mild form of exercise. Yes.
Okay. Thank you, doctor. I have actually one more question that is addressed to you as well. How you know that you have high risk? Yeah, so let me just pull out the slide for you.
So yeah, so the risk is actually yeah, I think I've shown. So this one, so this previously the guidelines suggested patients are classified patients with diabetes as having low risk, moderate risk, and high risk. Okay, so now actually this slide shows severe conditions. For example, those who have experiencing very severe low glucose even before Ramadan. Okay, so they're having attacks of low sugar even frequently before Ramadan, or who are having very high uncontrolled blood sugar leading on to ketoacidosis, as I mentioned earlier in my talk, like case 1. And then somebody who's having your diabetes control generally very, very poor. The doctor says, you know, the sugar control is very bad. Or somebody who's on kidney failure, very old age with a lot of medical problems like heart disease, kidney disease, etc. And then patients with poorly controlled diabetes are generally considered, those thing mentioned here is actually considered as a very high risk. So nowadays, actually, for the health professionals, many doctors and the nurse clinicians can actually estimate, they can calculate the risk actually according to the scoring system, the new scoring system run by IDF DAR. So they consider the type of diabetes, whether they have type 1 or type 2 diabetes, or whether they have some other conditions like heart disease or stroke, whether they are pregnant, so whether they are on what medications, they are on insulin. So they have come up with the scoring system, evaluating all those points mentioned, you can see in the slide, and then we come to the score. If the score is like less than 3, the risk is considered as a low, then actually it's quite safe to fast. But if the risk score comes as anything more than 6, we generally advise not to fast. But if you're still keen to fast, then you definitely need to discuss with your own doctor who looks after, who can advise you to consider changing the dosage of your medication or insulin.
Okay, thank you, doctor. Okay, so moving on to the other questions. Okay, this one let me address to Rachel. So is it okay to have breakfast, porridge for breakfast provided by the mosque continuously for the month, especially for diabetic patients?
Hi, yeah, so thank you for this question. So my understanding is usually the mosque would provide some dates to break fast, right? Then if they are providing some meals after the breaking fast, then porridge, it may actually increase your blood sugar levels quicker compared to other carbohydrates like rice or bihun. The reason being because usually porridges are usually cooked longer. So this means that your body does not need to do much to break down the food instead. So the sugars get absorbed a bit quicker, hence the spike is a bit quicker also. But if there are no other alternatives, and if there are no side dishes provided, then maybe may I suggest that some easily prepared vegetables like some cut cucumber, tomatoes, capsicum, or hard-boiled eggs, or some tempeh or tofu. You can prepare them at home and bring them together with you at the mosque and have them with the porridge instead. Yeah, so this can also help to prevent that quick sugar spike by including a protein and some fiber to the carbohydrates. Thank you.
Thank you, Rachel. I have one more question also. How many dates would be equivalent to 2 servings of fruits?
So one large date, we consider it is 1 serve of fruit. So if you are breaking fast with 1 large date, then you can aim for the other serve of fruit to be taken either at your sahur meal, or after, if you are still hungry after your meal, you can aim to have another serve of fruit.
Thank you, Rachel. Okay, so let me look through one more. Okay, this one I will address it to Faiza. I have a question asking, for nails on the toes that have black lines, what does it mean?
Thanks for the question. Yeah, so I think this is relatively common. I think some of us do find like these black lines on the nails. It could be a few things. One, it could be like a mole, on our skin, we have those black moles. So our nails also can have moles. So it will be seen as this streak of black line on the nail plate itself. It could also be fungal infection. So fungal infection, sometimes there's some discoloration on our toenails. So usually fungal infection is associated with other colors also, like yellow or whitish, or in some cases even greenish. But if the black lines actually extends beyond the nail into the skin, for example, I would say that, or it's causing pain or it's spreading, my suggestion is it's better for you to get it checked by a doctor to make sure that there's nothing serious about it.
Okay, thank you, Faiza. Okay, I have one more question on nutrition for Rachel. Is boiled potato able to replace porridge or rice?
Hi, thank you. So because potatoes are also considered a source of carbohydrate, so having moderate amounts, that means if you're having about 1 rice bowl of rice or maybe 1 rice bowl of porridge, then try not to have too much potato. So maybe 1.5 medium, or if you look at like your face, yeah, size of potato would actually be enough. So once again, just having carbohydrates on its own will tend to then increase your sugars quicker. So with every meal, try to pair your carbohydrates with a more easily prepared protein. Can be some steamed fish. You can have it, or if you are don't have time, you can just quickly put some beef into the oven to bake it, and together with some other vegetables like carrots, asparagus, and then you can have it together with your potato. Then after it will become a more well-balanced diet in that sense. Yeah, thanks.
Okay, one more. I think it's a follow-up question regarding the black cracked nails. Maybe Faiza can help me with this. How is cracked nails with line in the center? Okay, let me rephrase it. If there's a crack in the nail, like one line in the center, how do you take care of it?
Yeah, so cracks in the nails can be quite annoying, right? Because you can see that crack, and sometimes that crack, the edges is quite sharp, it catches on things. So usually what you can do is you can use a file to just file over the area so that the edges are quite smooth, so it doesn't catches on your socks or your blankets, for example. Also, just to make sure that you keep it clean, nothing gets stuck inside, because some things, some dirts can get inside as well lah. Yeah, so I think those are some of the main advices or some of the things that you can take note of with regards to the cracks in your nail.
Okay, thank you, Faiza. Okay, I have no more question. So if you have any more, we still have a bit more time, about 1 to 2 minutes. If you have any questions, do type it in the chat box. Maybe I'll wait about 30 seconds. If you have any, you can type it in. Yeah. Okay.
There is one more question on the chat box about the having the dates. So I think it's recommended. I think somebody asked. It's recommended to have dates in odd numbers like 1, 3, 5, and 7. Yes, it is sunnah. It's a recommended sunnah to have 1, 3, and 5. But as Rachel pointed out, the dates will have sugar in it. So if you have diabetes, if the diabetes is under good control, I think 1 or 2 dates is actually shouldn't be. One definitely is definitely acceptable. Up to 2 days is acceptable. But if your sugar control is really very poor according to your doctor, better to not to take more than 2, which is as it is only a recommended sunnah. As we know that even following sunnah, sometimes you have to be careful. If it is going to harm you by increasing the blood sugar, it's better to not to take more than 1 dates. But if your sugar control is good, you can take, I think some of the guidelines say you can take up to 3 dates at the maximum, but better you can split it up, as Rachel mentioned. You can take 1 at the first and then followed by some protein intake, other food, then you can have another 1 or 2 at the end of the iftar.
Okay, thank you, Dr. Okay, so I do see that there's no more question in the chat. Okay, so if there are no further questions, thank you everyone. We have come to the end of our talk. So hope this session has been helpful to everyone to help you fast safely in the upcoming Ramadan. Okay, before you go, we would like to take a quick picture with everybody. So can I trouble everyone to just turn on your video so that we can just take a quick picture? Okay. I'll just give some time for everybody to start streaming in. Okay. Ready? Put out your best smile. Okay, 1, 2, 3. One more time. 1, 2, 3. Okay. Thank you everyone. Okay, before you go, we also want to hear your feedback and comment for our health talk. So Okay, yes. So do scan the QR code on screen you see here to fill in our feedback form. Otherwise, you can also access the link in the chat box. My colleagues will just put the link in the chat as well. So for those that miss out the QR code, no worries. If you're unable to access the form, we will send the feedback link in your email post-event. Okay, so that's all for today. Thank you everyone for joining us. We have an exciting lineup of talks from March to April. Our next talk is actually happening this coming Saturday. The topic is empowering you with diet behavioral change. Empowering you with diet behavioral changes, overweight, diabetes, and kidney impairment. So if you are interested, do sign up using the link provided in the chat or get in touch with us by emailing us at char@ttsh.com.sg and we will share with you the link there. Okay, till then, have a nice day and goodbye.